Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to today's episode of Dr. Ozello Sports Medicine Report. Today I'm going to speak about lumbar facet syndrome. The lumbar spine is the medical name for the low back. The facet is the posterior or back part of the vertebrae. Low back pain is one of the most common musculoskeletal complaints encountered in clinical practice. Lumbar facet syndrome is a common condition that causes low back pain. The facet joints are also known as the Zygapophyseal joints or the Z joints, and they are also known as the apophyseal joints. The lumbar facets are composed of the inferior articular process of the vertebrae above and the superior articular process of the vertebrae below. The zygapophyseal joints serve to stabilize the spine and prevent injury by limiting the spinal range of motion. The facet joints are true synovial joints. They contain cartilage on each surface and are surrounded by a capsule of connective tissue. The superior articular process and inferior articular process branch off the arch superiorly and inferiorly between the pedicle and the lamina. The pars interarticularis, also known as the pars, is the bony bridge between the superior articular facet and the inferior articular facet. In combination with the disc, the facet joints create a three-joint complex at each vertebral motion segment. A greater workload is placed on the facet joints when the spine is extended. Spinal extension is bending backwards. The facet joints are prone to degeneration over time and can cause chronic low back pain when irritated. The symptoms of lumbar facet syndrome can be acute or chronic. If they are chronic, it usually begins as an insidious onset. The symptoms are often described as deep, dull, achy pain. They can be unilateral or bilateral, meaning they can occur on just one side or it can occur on both sides of the spine. There is usually point tenderness, meaning you could point to exactly where you feel the symptoms, and if you put pressure on that area, it causes pain. Muscle hypertonicity and muscle guarding are often present. Symptoms may radiate into the bilateral gluteal area and into the proximal hamstrings. Lumbar facet syndrome is aggravated by lumbar extension, which is bending backwards, and it is often aggravated by standing. The pain will increase with lumbar hyperextension, extension and rotation, and straightening from a bent or flexed spinal position. Localized unilateral back pain, pain with palpation of the facet joints, and pain relieved by flexion are common characteristics of lumbar facet syndrome. Lumbosacral facet syndrome can occur secondary to repetitive overuse and microtrauma, spinal strains, and torsional forces, poor body mechanics, obesity, and an intervertebral disc degeneration over the years. Lumbar facet syndrome is a painful and performance-limiting condition. Like I stated before, the symptoms are usually a deep, dull, achy pain. They can be on one side or they can be on both sides of the spine. The pain increases with standing, with lumbar extension, which is bending backwards, and when you are in a flex position and you are moving into an extended spinal position, and also when you are extending the spine and rotating. Oftentimes, the muscles in the lumbar spine become extremely tight. In medical terminology, we call this hypertonic. These muscles become tight when there is facet syndrome present because it wants to prevent you from moving into a position that elicits or intensifies symptoms. So what you want to do is you want to stretch these muscles while moving into flexion. There's a series of exercises called the Williams flexion exercises, or sometimes known as the Williams lumbar flexion exercises. I already did a video on those, so I'm not going to completely go over those exercises in this video because I don't want to duplicate that video, but that is a video that would be very informative with a series of exercises and stretches that would help someone with lumbar facet syndrome. Two of these stretches are done supine. You are bringing the knees towards the chest. In each of those stretches, one is a unilateral stretch and one is a bilateral stretch. So go ahead and look at that video. Try those exercises if you have lumbar facet syndrome. You never want to perform any exercise that is going to elicit or intensify symptoms. Therefore, if you have lumbar facet syndrome, you want to stay away from performing any lumbar extension exercises. Now is time for the disclaimer. Please realize watching this video does not take the place of seeing a medical professional. If you think you have a lumbar facet syndrome, or if you have any other type of musculoskeletal condition, please see a medical professional. You can see a medical professional like myself. I am a doctor of chiropractic, or you can see another type of medical professional. But please see a medical professional to get an evaluation, a diagnosis, and to help set you on your recovery path. Also, never perform any exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, stop immediately and find a viable substitute. Never perform an exercise into a painful range of motion. You always want to perform all exercises through a symptom-free range of motion. Again, you always want to perform all exercises through a symptom-free range of motion. Even if that motion is minuscule, you always want to work through a symptom-free range of motion. To help to prevent or rehabilitate lumbar facet syndrome, you can perform core strengthening exercises. These exercises can be the very fundamental core strengthening exercises, such as the abdominal drawing in maneuver, abdominal hollowing, which is also known as stomach vacuums, and abdominal bracing. You always want to perform these exercises at your current health, fitness, and strength level. There are many reasons that low back pain can be present, and lumbar facet syndrome is one of those reasons. This is a common condition, so do everything you can to prevent this condition and do everything you can to rehabilitate this condition. You could perform stretches while the spine is moving into flexion, and you could perform the strengthening exercises for the deeper core muscles. Again, look at the Williams lumbar flexion exercises and look into core strengthening exercises such as the abdominal drawing in maneuver, abdominal hollowing, which is also known as stomach vacuums, and abdominal bracing. Thank you, everybody, for watching today's episode of Dr. Ozello Sports Medicine Report, where I covered lumbar facet syndrome. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can visit my website, championshipchiropractic.com, where you can get additional information on the book, and you can find my blog. My blog contains articles on spine health, chiropractic care, sports medicine, exercise, fitness, health, and nutrition. Please feel free to like this video. Please subscribe to my YouTube page. If you have questions, comments, or feedback, please leave them in the comments section below. Also, always remember to train hard, but train smart. Get adequate rest between training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free. Completely rehabilitate your injuries and accomplish your goals.